Test 44, test 44.
Can you hear us? No.
No.
All right.
Test, test, test. Nothing, nothing. Hi, now, Annie.
Lonnie,
Bonnie.
test. Oh, can't hear anything.
Oh, I know. Got it.
Hey, Rory.
Right now.
Can you hear me, Michael? Michael, can you hear me? Nope, he can't hear me. Uh, is there another mic we could use? Michael, can you hear me? We're still trying. I can't hear him up here. Can you guys?
Got it. Thanks.
Okay, go ahead, try it.
Michael, can you hear me?
go ahead and call our board managers meeting to order this Thursday, October the 12th. So we will begin with our opening prayer. All right. Okay.
Most gracious and loving God, we come to you today asking for your guidance, wisdom, and support as we begin this meeting. Help us to engage in productive and meaningful discussion and strengthen our bonds of community. Fill us with your grace as we make decisions that will impact our patients, families, clinical staff, and administrators. Continue to remind us that all we do here today is for the pursuit of fulfilling our mission. We thank you for all the new things we are doing and for the opportunity to be a beacon of hope in our communities. We thank you for helping us to accomplish our work and our goals, and we pray for your continued blessings and guidance. We pray all these things in your holy name.
I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Do we have any citizens wishing to address the board? We have none. Okay, then we will move on into approval of our minutes. Are there any corrections to the minutes? Okay. If there are no corrections, I'll entertain a motion for approval.
Second.
All right, it's been motioned by Zim, second by Roger. All those in favor of approving the minutes signify by saying aye.
Aye.
Those opposed by nay. Motion passes
I just
unanimously.
want to remind the board of the efficiency of last month's meeting.
All right, don't start picking on me. They told me you did it in 14 minutes, and I said I read the minutes. It was 45. Okay. I do not have a report for today. Dr. Duncan?
Yes, thank you, Madam Chair. Board, you may have noticed that Leanne Franklin did not lead us today in prayer. She has left the organization to care for her mother in Kansas, and so we will truly miss Leanne. We have left the door open for her to return, but I did want to let the board know that because many of you know of Leanne and the great work that she's done here at JPS. I'd like to start off, I did send out notification of a couple of changes on the executive team. For those who may not have received the notification or had chance to get to their emails, I do want to inform the board that Jill Farrell has stepped in as interim chief operating officer for JPS. And with the departure of Sharon Clark, Rory McCready, who serves as our Senior Vice President over Revenue Cycle, has stepped into transitional leadership over the Finance Department as we start our national search for that position. We've kicked off the new fiscal year, and it remains very busy. As I had outlined to the board during our budget retreat, we often have within the organization a lot of agencies that are moving through to oversee a lot of the surveys and a lot of the accreditation that we are required to have. So over this past month, we had the NICU Level 3 survey that we did very well with, the Texas Commission on Law Enforcement audit that we did very well with, and the state inspection for radiology services at our cancer center. Again, we did very well with it, so I do want to thank those teams. We also had one of the largest surveys, probably secondary to our joint commission, which is the CAP survey, the College of American Pathology survey that oversees our lab services. And so we had an amazing survey, but I'm going to let Dr. Miles speak to that survey. And I want to thank both Dr. Miles and Joy for their leadership over the lab, but more importantly, the team that works every day within our lab. So, Dr. Miles, could you say a few words?
Well, sure. Thank you, Dr. Duncan. This was the 5th CAP inspection under my leadership as medical director, and we've come a long way. Many members of this board were present when I first arrived, and I had to come before you and explain the task that was ahead of us. And it was a fairly large hill. And I am so proud of my team that they have not only recovered their regulatory compliance, but exceeded even my expectations. The survey this year had 3 deficiencies. 2 were corrected on site. That means 2 of them were so minor, we could get a signature or print a piece of paper and they were corrected. And the only one that we're going to have to answer to the College of American Pathologists is related to a survey for physician satisfaction with the lab. So that's really, it's not like we forgot to do our quality control last month. We just didn't survey physicians this year. So I can't say enough things about our team. This is a continual readiness in the laboratory. This is not like we run around for 3 weeks and get ready for an inspection. It is unannounced. The team just arrives and gives us a call at 7 o'clock in the morning. So this is really a testament to continual readiness in the laboratory, the frontline workers, and the leadership. I couldn't be more proud. And I told Dr. Duncan, I'm really especially proud this year because I was in England when the team showed up. And my team has always said, oh, Dr. Miles, you help us through those surveys. You're the one that really helps us. And this was actually great that I wasn't there because it proved to the team that this is their work and this is their accomplishment. So I thank you, Dr. Duncan, for giving me the opportunity to speak to the board because we are absolutely over the moon with our results.
So thank you, Dr. Miles, and thank you, Joy Parker, because with that CAP survey, it makes our Joint Commission a little bit easier. So thank you. Blake, you had asked, I believe a contract had been presented, Joy Parker had presented a contract between JPS and Casa de Esperanza, and you asked a question about can we show some positive outcomes? So Joy's going to come forward and speak to those outcomes and speak a little bit about the Casa de Esperanza program. Thank you, Joy.
Thank you. Oh, there we go. So as Dr. Duncan was mentioning, we talked about Casa de Esperanza, and actually this conversation was during that board budget retreat when we were talking about strategically as we go into this fiscal year, how we would continue on our mission of transforming healthcare delivery for communities we serve through strategic partnerships. And so as part of our initiatives to make sure that we are partnering out in the community to deliver this care, we identified an opportunity that was birthed out of some of the activities that came from COVID. And so I think we can all say COVID was extremely hard, but it actually taught us a lot about what we can do together. So I'm actually going to start with the story from one of our residents within Casa de Esperanza and give you a little bit more background on the outcomes and that relationship. So this picture that you see here is Miss Addie. Miss Addie, she spent almost a decade in and out of shelters here within the Tarrant County area. She was caring for her mother, and that became her focus. And she was not even aware of all the different resources and options for her. So as the partnership between the City of Fort Worth, Tarrant County Homeless Coalition, Fort Worth Housing Solutions, and JPS came together, she was identified as one of our individuals that now lives within Casa de Esperanza in a permanent supportive housing unit there. She not only has gotten some more additional services and resources through Joy, and so starting out talking about CASA, there is a team, much like Dr. Miles spoke of, that is not here with me, but I serve as a liaison to speak on their behalf, and it's really the work that they've done, and it's because they have such a heart for our population caring for them. So CASA is primarily comprised of our JPS, those that are on JPS connections, as well as from a Latino and African American ethnicity and background. So what are the outcomes? And I'll talk a little bit again about how this came together. Our measure of success of our participation within CASA, we, from the very beginning, wanted to identify how partnering on something that is a social driver of health, which is housing instability, how this would positively impact JPS in our community. And so we looked at a population that was experiencing homelessness over since 2018 to that 2020 date when we instituted and started housing those individuals within CASA, and we looked at their baseline of those individuals for ED visit volume. And so we took that as our baseline, and then in what I'm presenting to you is what are the results of that? Like, how have they fared since they've been housed? And so working with our finance department to pull this data, we identified within the 119 individuals housed within CASA, we have seen historically from their utilization a 48% reduction in ED visits. And so the numbers that you see here in the math, you might say, well, it's 136,000, Joy. That probably doesn't cover your physician that does the house calls. That is just us being very conservative and saying it's just an ED visit, and that they would only come for like a level 4 and 5 activity. So no downstream, no hospitalizations. We made the most conservative assumption, but we all know that when you have an ED visit, subsequently there tend to be hospital visits associated. And so for us, when we talk about the work that Jill and Dr. Carla Pudi and Dr. Kirby do within the ED, every patient that we can avoid an ED admission makes a difference for our community and this organization. And so here you can see kind of the savings and reduction in utilization, which I think is really just the beginning. So overview, what is happening within Tarrant County? Well, if you look at Tarrant County Homeless Coalition, their website, I sit actually on the board with many others with TCHC, but they say currently there are about 3,900 individuals within Tarrant County that are experiencing homelessness, and in Fort Worth it's around 1,800. So during the summer of 2020, there was COVID CARES money that was at play within the city of Fort Worth. And so the city of Fort Worth looked at this COVID CARES money that could be utilized for housing and partnered with TCHC and Fort Worth Housing Solutions for about $9.3 million to renovate an old building and facility, Casas de Esperanza, in 19 units. And so when that came together, part of the requirements associated with individuals being housed in these units were that they had to be experiencing chronic homelessness of defined as greater than 12 months of homelessness, as well as over the age of 65, and or they were COVID vulnerable. And so in order for the individuals to qualify, they needed a medical provider to say that they would meet criteria to be qualified to participate in this program. So as we were approached, and we'd already had a really good relationship because we'd been working with the city with housing individuals within the convention center, so we already had a very close relationship. As they approached us, and actually I'm so blessed to be a part of this conversation, as we talked to the city and worked with TCHC, we were able to say, hey, as we look for these individuals, our street medicine team is already caring for a lot of these individuals, and so can we take our list that helps you to identify those that are experiencing homelessness that we are already seeing in our EDs and match that up with the list that you have and help to begin to screen those individuals and get them housed quickly. We had a very tight timeline. Dr. Lonergan, who is now with MHMR, and everyone I think loves Frank Lonergan, but him as well as Joel Hunt, who we know on our street medicine team, worked feverishly with our operations team to identify, screen, and report the criteria to get these individual housed. So by December 20th, we were housing our first within CASA all the way through March, 119 individuals within the CASA. So what services does JPS provide? So currently our contribution to all of these residents within CASA is that Dr. Savarin makes house calls to CASA. So he goes to CASA, he works with caseworkers there. We're fortunate that as time progressed and the funding associated with CARES money for our caseworkers was running out, we worked with Fort Worth Housing Solutions, and through their grant, they actually helped to fund and underwrite the community health workers that JPS provides, again, through partnership. And so Dr. Savarin does the house calls, and our community health workers, and I want to give a shout out. I don't know how many people watch this, right? But I'll tell them to go back and watch it. But Shalise Bragg, Carrie Aguilard, and then Dr. Andrew Saverin. As I spoke to Dr. Saverin about this program and told him I'm going to be talking about the work that you do, I said, what do you consider to be one of the most successful reasons that we've had such success with this population? And he said, Joy, these community health workers are a treasure, and they are priceless to the success of this program because they do the day-to-day work and partnering with the residents and partnering with our other partners that exist within CASA to make this a success. And so to Shalise and Carrie, I'll ask them to watch this, but they're the ones that are doing the work day to day with our residents here. You can see here with the work that they do. And then here are a few more pictures. So we, again, partnering purposefully, strategically, this is a great model of how we're showing that the social drivers of health, while we JPS cannot be the ones that do the housing, we can partner and we can come together and help support that medical need associated. It's a success. And we do that with other partners within CASA. We have the Tarrant Area Food Bank. We have benefit specialists that help from THC. There's weekly group self-help classes. There's pastors that are involved. We have AA meetings, MHMR. There's exercise groups. Azealia, who's sitting behind me, behavioral health team, as you know, they support, and we make sure that whether it's transportation assistance or right there within CASA, we help to meet that need. So with that, I'm happy to answer any questions. I knew I had a video update, so I know it's supposed to be brief, like if Roger was going to do it. And so I'm happy to answer any questions I can about this work.
Joy, what are the costs that JPS pays for and who pays for the housing?
So the housing is through a grant through Fort Worth Housing Solutions. So they are helping to support that once that CARES money dissolved. The support that we provide, as I told you, it's Dr. Saverin and the community health workers. The community health workers is funded through Fort Worth Housing Solutions. We provide Dr. Saverin's time. Now, Dr. Saverin doesn't just see CASA residents. He is seeing other patients that are at our True Worth place, which is our clinic, our medical home that is mostly dedicated to persons experiencing homelessness. And so again, a lot of these individuals potentially would have been seen by Joel in street medicine and or in our clinic. And so there's not really any change there if you think about it, because it was a population we were maybe supporting in the outpatient clinic setting. And so that's all on that end. I don't know. Yes. Yeah, my kids watch Disney, so Encanto was all I knew, and that was a miracle, so it wasn't close.
So how long, sorry. No, we're good. So Tarrant County, or Fort Worth Housing provides, how long do they have funding for the housing piece? CARES is running out.
CARES run out. So Fort Worth Housing, I don't know Fort Worth, so Fort Worth Housing Solution has, if you look at Fort Worth Housing Solutions, their Mary Margaret, their report, it's listed as one of their now standard supportive housing within their program. So it has been just, brought into the fold of the rest of those solutions for those that are, experiencing instability in housing.
Okay.
Joy, I was curious, where did the metric come from that concluded that an emergency visit was $575 per visit?
So for finance, we looked at level 4 and 5s and looked at just an encounter with the physician and very basic lab, just a very basic. So I didn't want to come with we didn't want to come with, it's imaging and all of these things. We just tried to take a very conservative approach because when you're saying cost savings, that can get really murky because it's really dependent on the person.
Yeah, I agree, and that's kind of what I figured your answer would be. The truth of that savings is probably 4 or 5 times that.
Yeah.
Probably.
If we look before at that emergency department metric, it ain't $575.
Yeah.
It's a lot more than that.
Yeah.
So, just underscores the importance of this financially and what a great benefit it is to be able to offer this and also, reduce our own exposure and our own costs and help these folks out in a way that's very meaningful. So congratulations. Very good work.
Thank you. Yeah, and our team, our community health worker team is actually presenting this to a coalition down in Austin as a poster highlighting the work that we do. So we can actually help to teach, this model to other local governmental entities.
Joy, one more question. Is the building owned by Fort Worth Housing Solutions, or is it leased, or?
So there is a developer group that came in alongside, and I'm going to not, if you Google it, you'll see their name. But from what I understand, Fort Worth Housing Solutions, with that 9.3, they purchased that in a deal with the developer. And so I think those are great as far as how that model looks for that. I think Fort Worth Housing Solutions, Mary Margaret Lemon's probably the best person to get more details on that.
Okay.
All right. Joy, I have a question. Once a resident is admitted into the facility, are there any requirements for them to stay, or is it like a finite amount of time that they stay?
Yeah, no, that's a great question. So it's permanent supportive housing. So the idea is that they are there and this is their home. Is there some natural turnover? Yes. I do not know that percentage, but I do know that we do have many residents that since they were housed within that timeframe within 2020, the majority have stayed there. What we pull some metrics is around like how often they're actually seeing Dr. Savrin and making sure that that continuity of visit is happening. So we track that as well as kind of a sub-metric as well.
Any other questions? Well, Joy, thank you for the report. It's a great report, and I'm glad to see the outreach effort that JPS is doing. Okay.
Madam Chair, that is all I have for my report today. Thank you.
Okay. All right. Dr. Miles, update or?
Thank you, Madam Chair. Just a few quick updates. The medical staff is on its 2-year cycle to re-elect medical staff officers. That election is actually going on as we speak. There are 5 officer slots that are available. There are 2 candidates in each nomination. So we'll have the results of those available for our annual medical staff meeting that occurs at a joint meeting with our MEC in November. Also in November, we expect to have the general medical staff vote on our bylaws amendments. Mostly housekeeping this year, not a whole lot to bring back to you, but you will see those for approval depending on when they hit your agenda, December or January, I would imagine. I am really proud of the fact that we're doing this because this is the first time we've done a regular annual review of our bylaws. Previously, we would and say, oh gosh, we need to look at our bylaws again. So we are on a track now that we are continually reviewing them, and so you will see these come through on an annual basis. That's all the updates I have, Madam Chair, and the one piece for approval is the credentials memo should be in your red folder. There is nothing to report on this slate of candidates. These are fully vetted through our credentials process.
Okay. Did anyone have any questions on the approval for the medical staff appointments and privilege? There was no questions, and I'll entertain a motion for approval. Okay.
Second.
All right, it's been motioned by Steve, second by Zim. All those in favor of approval of the medical staff appointment and privileges, please signify by saying aye. And those opposed by nay. Motion passes unanimous. Next, we will have our committee reports, and we will start with Finance, Planning, and Investment Committee. I don't know who's going first, DT or Trent?
I will, mine's the simplest and shortest.
Okay.
So I'll go first. No action items on the planning agenda, but just as a reminder, we have updated our placemat for our master facility plan that Adam went over with us. Our PEC construction is continuing underway. We have finished our first temporary parking lot. We've got 3 more that are scheduled to be completed in December. And currently we have the MHSW currently working on the foundation and framing and underground utility trenching. All these projects are on schedule. All these projects are under budget. So keep it short and sweet.
All right, very good. Any questions of Trent? Yes.
I might add on that. Drop by the medical site. You see a medical home developing.
Hard to build, isn't it?
Yeah,
All right. DT?
Yes, ma'am. Well, we met on September 28th for the August result. And something notable here is that from the August financial year, our combined operating margin was $20.3 million, which was about $3 million down from the type of things. Year-to-date operating expense or $89 million over budget. The HARP was approved by CMS after the budget was set and is now being accrued monthly also as well. Both the month and the year-to-date salary and benefit continue to exceed budget, primarily due to the patient volume and also compounded by the mid-year adjustment of the salary also as well. Also as well. Things that our CFO was reporting was the 2024 budget was approved by the Commissioner Court on September 19th. And then September is going to be our last, the year end wrapped up, so we'll receive that report next month. No, actually on the 24th. Report.
All right, thank you. Any questions of DT? All right, thank you, DT, and thanks, Trent. Zim?
The government's risk. Is ongoing security for more refined risk presentation. Government transformation over the past 2 years showcasing a notable ROI include implementing a corrective action plan yielding over $5 million in captured revenue, introducing a risk-tailored resource allocation model for compliance, unifying compliance efforts across JPS Health Network and a claim multi-specialty group, streamlining operations, combining roles, and reducing FTEs, achieving a net reduction of 7 FTEs, and enhancing oversight by consolidating internal monitoring and establishing a conflict of interest declaration program. Initiatives for the next 2 years include independent assessment of compliance program effectiveness, aligning policies with OIG and DOJ expectations, enhancing third-party oversight and feedback mechanisms for coding and billing, maturing drug diversion prevention program, and developing a generative
Correct, I am. Thank you, Madam Chair. As DT mentioned, this is one that we tabled from the Finance Committee agenda because we received some late changes to the contract from the vendor. So many of you had already seen the executive summary, but this is a request for approval of an exemption to bid and agreement between Cepheid and Tarrant County Hospital District. This agreement is to purchase reagent for the analyzers that we have in our lab. It also includes an upgrade to one of those analyzers. Joy and her team did a really good job of negotiating pricing on this, and so we were able to lock in more favorable pricing. But this is equipment that we need. The cost, the committed cost is for $884,126.40 annually. And if there are, Joy, of course, is in the back to answer any questions, but we're just bringing this one back so we can conclude the process on this one and move forward with locking in the pricing.
Okay, are there any questions?
Move to approve.
All right, it's been moved by.
Second.
All right, it's been moved and second. All those, are there any other discussion? All right. All those in favor of it's two parts, the exemption and the agreement, signify by saying aye. And those opposed by nay. All right, motion passes. Okay. I believe that we will we are up to the consent agenda. Are there any items anyone wish to remove from the consent agenda?
I have some questions about item B, so I guess if we need to pull that off to do the questions. But
Okay.
simple questions.
Well, can we just ask, can I just go and get the questions now? It's not anything I need to be in closed session for, is it? Okay, so what's your question?
So
maybe-
this is an amendment, and this is my fault because I missed this committee meeting, so apologies to everybody. The amendment is for $8 million some dollars. What's the total value, of that original contract? I'm sorry?
Yeah, and I don't know if he's here, so I'll have to, this was the design services.
That's right.
So as the work comes online, I know we have the different various scopes of work, and we will amend to add that. I don't know if the whole project was already scoped from a dollars perspective, and it would be, I can try to find that out for you from Adam.
And since it's an amendment, is this one that stays here, or does it go to the court for final approval?
This one does not, because I think that they had already approved the vendor and the project, so I don't think we have to send the amendment back.
Did you get your?
Those are my.
Okay, all right. So if there are is there anything else? All right. If there are no other items that anyone want to ask questions about, none to be removed, I'll entertain a motion for approval of the consent agenda. Okay?
Second.
All right, it's been motioned by DT, second by Ralph. All those in favor of approval of the consent agenda signify by saying aye.
Aye.
And those opposed by nay. Motion passes. All right, I believe that brings us up to closed session. And so what I would like to do now is to end our open session and go into closed session at 1:45. We have one item that we need to continue, and that is with our proposed resolution. And oh, sorry. Okay. Again, we have one resolution, one item that we need to complete, and that is on our proposed resolution. And we have option A and option B. And so I will entertain a motion for one of the options. No one want to make it? I'll recommend. Thank you. All right. A second. Is there any other discussion on that?
Just one bit of discussion. We've been presented with resolution and some amendments. Are these final or subject to council review still?
So those are the final ones. That's what you're voting on now is the resolution authorizing the amendment of the Tarrant County Hospital District Government Excess Benefit Arrangement to freeze and terminate the GIBA. That is option B.
And both are labeled plan freeze at the top? That's probably a typo.
Well, the amendment itself actually just freezes because that's the document that relates to the plan document. The termination is an administrative action that we have to take. There's nothing that would be included in the amendment. So that's actually not. The amendments are the same, correct.
Okay, thank you.
Is there any other discussion? All those in favor of option B signify by saying aye.
Aye.
All those opposed by nay. Motion passes unanimous. There being no further business, I will entertain a motion for adjournment.
So moved.
All right.